and you have too many white blood cells, that would be leukocytosis. If you do not have enough blood cells, that would be leukopenia. So how many types of red blood cells do we have? Just one, right? If you are a red blood cell, you are a red blood cell. That is it. You are a red blood cell. But for leukocytes, we have lots of different kinds, and that's because they have different functions. So the first division that we have to make within the category of being white blood cells is granular versus agranular. So A means without, and granular is granules. So those little dots that you see right here, for example, the little granules, that's what we're talking about when we talk about the granulocytes or the granular leukocytes. So next we look at the subcategories of those. Of the granular ones, we have neutrophils, which some books will call PMNs, which stands for polymorphous nucleocytes. And those are the most common of the types. They are multi-lobed, meaning that the nucleus looks like it has more than 2 lobes to it, right? They are phagocytic, and phage means eat, cytic means cells, so they're cell eaters. These are the ones that I always think of as like Pac-Man cells. And they are very, very important and very numerous because they are the first responders. So just like EMS, they're the first ones on the scene whenever there's an invasion of bacteria or viruses or anything like that. Eosinophils is another type of granulocyte. So that one is bilobed, and bi means 2, so you'll notice that their nucleus looks like it's divided in 2. These are going to be increased in number when you have a parasitic infection or an allergic reaction. And they also play a role in reducing inflammation. The last type here is basophils, and those are least common in tissues, but they have 2 very important functions. So they release 2 very important chemicals. One of them is histamine and the other one is heparin. You may have heard of heparin. Well, hopefully you've heard of both of these before. Heparin you've probably heard of. It is given as a drug, so we make synthetic heparin and we give it to people, and it's what's called a blood thinner. And so its function as a drug is the same as its natural function, which is to inhibit clotting. Histamine you've probably heard of in the fact that we make drugs that are not histamines, but antihistamines. So if you think about like Benadryl, what does Benadryl do? It reduces inflammation and it counteracts allergic reactions, right? So then you have to reverse that to think of what is it that histamine must do if an antihistamine does that? Well, histamine itself has to have a role in causing inflammation and allergic reactions. So those are the granulocytes because, again, they have those little granules you can see in that picture right there, all the little dots. But if we look at the other types of white blood cells, the agranular ones, we have to make 2 divisions. First of all, the monocytes, which are giant cells in comparison to the other ones. They're much larger, even in comparison to the other white blood cells. And these are the ones that are going to differentiate into macrophages, and macrophages are also phagocytes, so those are like the Pac-Mans that eat the bad cells. The other type is lymphocytes, and these are going to have a role in adaptive immunity, which is a more specific type of immunity. These guys are an innate immunity, which is the type of immunity that doesn't discriminate. It just says, you look bad, I'm going to eat you, you don't belong here. These guys are going to be more specific in looking for their targets. So you have the B lymphocytes, which are also known as plasma cells, and they're like antibody factories. So they secrete these specific antibody to a specific pathogen. So I talked about how if you have been immunized against tetanus, let's say, it wouldn't necessarily help you against tuberculosis, right? Because the antibodies that your body has been trained to produce by being exposed to this one pathogen does not have any relevance towards another pathogen. So that's their major function, is to secrete antibodies, but you also have to have some that become memory cells. And like I said before, that's important because otherwise you'd have to vaccinate somebody consistently. Every time that their cells died that knew what the bad thing looked like, you would have to re-immunize them. And we don't want that. We want once per lifetime, or at least once every 10 years sort of a immunization schedule. So these are the guys that sit around like the old guy at a bar, knowing, what to look for next time if something bad happens. T cells can also be memory cells, but they are usually specifically for viral infected and tumors, as opposed to these guys that fight viruses and bacteria. And these guys come in different varieties. So there's cytotoxic T cells, and it's exactly what it sounds like. Cyto means cell, toxic means to kill or to be poisonous. So these kill cells, not necessarily eating them, but killing them with poison. And then there's T helper cells, which do help the cytotoxic ones, and then there's the memory ones. Natural killer cells, some books will call them lymphocytes, some put them in their own category, but these guys really belong to that innate immunity, the less specific type of immunology, which puts them in the same kind of class as these guys here. Alright, so the only other part, we have the white blood cells, the red blood cells, the other part of the formed elements is the platelets. Right, and I wanted to make a point to say that platelets aren't actually cells. They're cell-like, but they're not actually cells. What happens is that you get this giant cell called a megakaryocyte with multiple nuclei, which is where that name comes from, and then it explodes into pieces, and platelets are basically the pieces that it explodes into. And their principal function is clotting, so to prevent you from bleeding to death from a paper cut. That's why these guys are so important. As I told somebody who emailed me, I would not, / did not ask this question on the quiz, but I put this in here because a lot of times I think that when students are in this basic level anatomy and physiology class, they tend to just memorize the facts and wonder to themselves on occasion, why do I need to know this? Why do they make me learn so much stuff? And so this is kind of one of those, this is why we have you learn this kind of slides here. So we talked about a differential white blood cell count. What does differential mean? It's comparing one thing to another to see the difference between one and another, right? That's where it gets its name from. And this is a very, very common blood test that's run on just about every patient that comes into an ER for one reason or another. And the results that you get look something like this. And it's when you're less concerned about the actual number of cells, but more so their relation. So if you, this is more helpful to look at than the actual number, right? Because if you have 4,300 of something and you should only have 4,000, does that necessarily mean there's something wrong with you? Maybe, maybe not. Maybe your numbers are just a little bit high. Maybe your cells are just overly excited. They made a couple more babies. The important thing is to look for a shift. So if you're supposed to have 2% of something and you have 10% of something, that's much more important to look at to identify there being a problem. So then we gave some examples as far as somebody with 7% eosinophils. So we look down here and we see that you're supposed to have 1 to 4%. Would you say there's something wrong? Well, yes, I would definitely say there's something wrong, right? Because 7% is pretty much double what they're supposed to have. And what could be the potential cause of it? Well, that's where you have to look at the stuff that we've been learning, right? That's where the importance of the stuff that we've been learning comes in. What is it that eosinophils do? They play a role in parasitic infections, right? Allergies. So that's the sort of thing that you should be looking for in a patient that has an increased number of eosinophils, or an increased percentage of eosinophils. And that would be leukocytosis or eosinocytosis if you have too many, right? And it works both ways too. So it also works in the way of having too few, which would be leukopenia. So somebody with 10% lymphocytes, they look right here, you see that 20 to 40 is what you're supposed to have. So you can already tell that there's something wrong, and that they have about half or less of the amount that they're supposed to have. And what could be a cause for that? Why would you have not enough of these things? Well, HIV would be the big thing to look for in a patient that has a significantly decreased lymphocyte count, because that's something that destroys the immune system. There are other causes, but that's definitely the big one. The other thing that I wanted to say too is that this works both ways as far as, so if you see that this person has, you know, an increased number of this or a decreased number of this, it kind of clues you in for what sorts of things might be wrong with them, what sorts of things you could look for. But also, if you already know what's wrong with them, if you already know the sorts of problems that they're having, it can tell you what you expect to see here as well. So if you know that somebody's having an allergic reaction, for example, you would expect to see an increased number of eosinophils. You would expect to see an increased number of basophils, because both of those are going to play a role in an allergic reaction. Okay, antibodies and antigens. We are going to stop right here and turn this into another video, because that is a good stopping place. Stay tuned.